Hey guys, a question I've been asked a lot in my career: is it better to use ice or is it better to use heat when it comes to a musculoskeletal injury or chronic pain? And my preference is we use ice for the first 24 to 72 hours after an injury, and sometimes that could last longer than that. We may use ice for up to 2 weeks or even a greater length of time. If it's a surgical patient, we may have them ice maybe for 6 months after a surgery. And then when it comes to heat, we typically put that on prior at my clinic prior to stretching someone or having them exercise if they have a painful joint in order to warm that tissue up, and also to help relax muscles if we're trying to stretch muscles out and get those muscles to be more pliable for exercises or other functional movements. And also we use heat for someone that has something more chronic like arthritis, a chronic bursitis, or a tendonitis that's been going on for a really long time. And basically the way that the ice works, it's causing vasoconstriction. So it's causing our vessels to constrict to reduce blood flow to the area. So for instance, if you sprain your ankle, the brain sends a whole lot of fluid there as part of the inflammatory response to try to heal this tissue. But it really doesn't know how much to send. So it sends a whole bunch of fluid. So we have to calm that down because we don't want too much fluid, because we want to make sure that the good healthy fluid's getting in and out, and also we don't develop what's called compartment syndrome, where the fluids swells out and compresses nerves and so forth. So we use ice to try to combat that. And also ice has an analgesic effect where it does have some pain relieving effects just by the coldness itself. So we usually recommend for about 20 minutes at a time. Always monitor your skin throughout when you're icing. If you have any decreased sensitivity or other skin conditions, blood flow conditions, blood thinners, those kind of things. You have to really be careful when you're dealing with ice, but we just monitor that closely. So just be aware of that whenever you do that at home. And whenever you're using heat, same concept, monitor the skin. We use it for 20 minutes or so, maybe 25 minutes. And what heat is doing is actually causing vasodilation. So it's causing the vessels to open up, which stimulates the inflammatory response. So sometimes you may put the heat on and you may feel better at the time, but it may be more sore, swollen, or painful afterwards, the area that you're applying that to. So we usually don't use heat unless it's a chronic, more long-term situation. But both have benefits. There's been pros and cons to both. That's been debated in a lot of medical journals. A lot of orthopedic surgeons have talked about that, and as well as therapists, and everybody has their own opinion. But for me, over my career, that's typically the way that I've done it, and it's worked out really well for our patients. So anyway, if you have any more questions or anything regarding whether you should use hot or cold or other things to combat musculoskeletal pain and or injuries, just give me a holler, guys. Thanks so much.